Hi, I'm Jaron Riley. I'm a pediatric orthopedic surgeon here in Denver, Colorado, and I specialize in pediatric spine surgery, specifically in the treatment of scoliosis. One of the things that we are pioneering here in Denver, Colorado is the use of a device called vertebral body tethering, which we hope leads to a solution for young people with scoliosis where we can not only straighten their spine, but also keep the spine as flexible as possible and have the spine be as healthy and lifelong durable as possible. So one of the questions I get asked often, daily, multiple times per day, is how does vertebral body tethering differ from traditional spine fusion surgery? In order to consider vertebral body tethering versus posterior spinal fusion for scoliosis, it starts all the way with patient selection. So with vertebral body tethering, you need a patient who is relatively young, who has a great amount of growth remaining, because tethering actually harnesses the remaining growth to allow the spine to continue to get straighter and straighter through the growth process. It's also likely that a growth that stimulates the change in the shape of the spine will lead to a spine that keeps its straightness for a longer duration of time, perhaps even over a lifetime. The recovery from posterior spinal fusion and vertebral body tethering is also a little bit different. I would say the pain scores for the kids going through VBT are slightly lower. The ability to leave the hospital earlier is better with vertebral body tethering, and they'll return to their sports a little bit earlier than they would with posterior spinal fusion. So overall, patient selection is quite different, the recovery is quite different, the surgery itself obviously is different, including the approach. One of the huge advantages we have here at Rocky Mountain Children's is we have general surgeons who are really gifted in the art of thoracoscopic surgery. That allows us to use really small incisions to approach the spine rather than the traditional large incisions that we use for spine surgery. So in a lot of ways, there are advantages to pursuing the newer technologies that allow motion in the spine after surgery. They allow us to do a surgery that's less invasive or less intrusive to the tissues through which we pass to perform the surgery, and recovery tends to be slightly easier, slightly faster. Long-term studies, of course, are necessary for us to know how this is going to play out over a lifetime, but so far it looks like vertebral body tethering is off to a really good start.